Hello. Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, someone processing their thoughts, in addition to repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. Today I have Dr. Kennedy with me. She is here to discuss what she created and how it can help people with ortomotor challenges. Dr. Kennedy is a double-boarded certified pathologist in both anatomic and clinical pathology. With her extensive medical background, interest in head and neck health, and unique experience of human tissue evaluation over many years, she has designed products intended to help correct the underlying disorder of the facial, orofacial, and oropharyngeal musculature due to dynamic muscle discord as specific muscles weaken and atrophy relative to others during the aging process, or from other etiologies. Welcome, Dr. Kennedy.
Hi, Kay. Thank you for having me on your podcast. I'm thrilled to be here today.
Please introduce yourself.
So, as Kay had mentioned, my background is pathology. I'm double boarded in anatomic and clinical pathology. And so for me, as I was progressing through life, kind of getting to that middle age life, in that segment, I noticed changes with my own health that I needed to address, and also some struggles within my own family with airway issues and sleep. And these things were starting to really come to the forefront. So I started to do some types of exercises in the head and neck area to help strengthen my muscles and do these things, Kay, because I was snoring. I started to snore. I'm a lifetime allergy sufferer. And so we're prone to have mouth breathing, periodic mouth breathing through my whole life. And as a child, I had retraction orthodontics in the late 70s, early 80s, before we knew that it's important to grow and allow the palates to grow to their full genetic potential. So as I started to snore and I started to do these exercises, I realized I really need something that will help me. I need a tool. I need something that can really help me. So I started to tinker around with some medical grade balloons that we use in the hospital setting. A lot of my colleagues will use medical grade balloons to help medical conditions like blocked arteries for angioplasty, things like this, or esophageal dilatation. We use balloons, medical grade balloons, in just about every orifice in the body. And these balloons can deliver chemotherapy, they can deliver antibiotics. So there's a lot of wonderful medical uses for these types of medical grade balloons, but it wasn't working in the oral cavity. So I had to switch gears. And then I ended up working with another manufacturer where we came up with where I came up with the design. And then we found a really safe, food and contact safe material, silicone, same type of material that is used in infant pacifiers. So it's very soothing to the mouth, being very smooth, and of course, FDA approved silicone. And so this triangular shape is very complementary to use in and around the mouth and engage the lip and the cheek muscles as well. So really it's basic strength training the muscles to bring back good function and maintain strength over your whole life. And so this was a game changer for me, and I decided it works so well, I'm going to bring it to market and let it and share this with folks that could really benefit from these types of movements, strengthening and working on coordination of the oromotor muscles. So that's
Why
where
did it not work the same in the mouth?
Well, the balloon, the shape, they were not able to do a balloon in the specific shape that I wanted. And we tried, Kay, we tried and we tried. And the balloon people that I worked with, they were wonderful. But the balloons would arrive and they were deflated because they would travel on an airplane. So you have the different pressurization. So we just really exhausted that effort. And to try to do this shape is so difficult. So this is now such a more easier process to get what I needed. And it's stretchy. You can stretch these. They're compressible, flexible. So yeah, I know. And hence the name. That's why it's called Beauty Balloon, because I just kept the name originally because I had already started down the pathway thinking, oh yeah, I'll be able to do this. I'll be able to get what I need in a balloon. And so we just kept the name, even though it's not a balloon.
How long did it take to develop?
It took a while. It took oh gosh, it took, I don't know, maybe about 6 months to a year. I got lucky because I did find someone near me who was able to make some prototypes for me. So we were able to test some different diameters so I could get the right diameter where I wanted it in the gum and get the right shape of the triangle and get the edges right. Just because you put your tongue through this to help strengthen the tongue, and you use every part of the tool. I take advantage of using the apex and I take advantage of using the base. So as we move it and manipulate the tools in and around the mouth, we're able to use the full design of the shape. So I got lucky. I got lucky with finding this local prototype maker who did a really great job. And so if I had not found him, it might have even taken longer. So, but it's an interesting process to bring a product to market. It's a learning process. It really is. So, but here I am on your podcast, which is
What
wonderful.
unique needs or goals of neurodivergent individuals does it support?
hmm So for so my focus, of course, is the head and neck region. And my whole kind of mantra, if you will, is to think about fitness, okay, from head to toe. We always think of fitness sometimes about thinking of it more of below the clavicle, where we really want to focus what is my overall fitness? What is happening in the head and neck region? How is my swallow pattern?
Mm.
How do I breathe? Am I really aware of how I'm breathing? Am I breathing through the nose all the time? How am I breathing at night? And really, sometimes our parents or our loved ones, my spouse, those are the ones that will tip us off at first on how we're sleeping. If we're making noises when we sleep, snoring, or if we're gasping for air, or if we're restless, if the bed linens are tossed and turned and these types of things. And I also have a child that with cleft lip, cleft palate. So the craniofacial, uh, issues without having a palate also encourage me to also move more forward with these types of tools too, to help with that. So all of this can help someone who is struggling with oromotor function. And first it becomes with education and awareness, and then you can use tools to help strengthen and train the muscles to work properly and posture. And we're always working toward harmony, right? We're always trying to work toward muscle harmony. And we have so many forces that work against us all the time. This is my husband. We laugh about this all the time. It's like entropy in physics, right? Everything always goes towards entropy, right? You think you've cleaned your shelves, you organized all the Legos, and then you come back in an hour later and it's a mess. Everything's a mess. So it's the same
I
thing. And
have dysphagia.
Dysphagia, exactly. And so for building a strong swallow pattern, this is so helpful to strengthen the tongue and allow the tongue to live where it should be, up on the palate. We want the tongue from the tip right up behind the front teeth, the incisors from the gum, all the way back as best as we can all the time and through the night. So it's lightly suctioned up there. But in order to do that, it has to be strong enough. And so if we have a low resting tongue, that can weaken over time, just like you said, Kayla, and have dysphagia and some challenges with swelling, which can be distressing. And people will have to alter their food choices and monitor these types of things. And of course, from my background, Kayla, coming from more of the adult population in the hospital setting, this plagues our geriatric population, dysphagia. So, and that's from a weak tongue. So this is what can a lot of time keep patients in the hospital is aspiration risk. And that's ultimately is aspiration risk. And that's really the heart of what we're getting at is we want to prevent aspiration risk, which can lead to aspiration pneumonia. And that can be a very risky situation if somebody is having this type of risk factor. And the aspiration doesn't always necessarily just have to be with food. It can be your own saliva. And that, and it can be silent aspiration. And sometimes people don't know it, Kayla, with a silent aspiration where they can aspirate on their own saliva, which has bacteria in it, which can get in the airway and wreak havoc on the lungs. And what's interesting, my background being a pathologist, of course, the pulmonologist, a lot of the time I would get specimens in the hospital. Um, they do the bronchoscopy on the patient and they get out the secretions from the trachea, from the airway. And it would come to someone like me, the pathologist in the hospital, and I would look at the slide under the microscope. And sure enough, I could see little flecks, little microscopic flecks of food contents, whether it be a vegetable matter or skeletal muscle or something like that. And so there you go. And there's your aspiration pneumonia diagnosis by somebody like me who would see it on the slide. So this is why I really, and like I said, this is a huge issue inside our hospital for patients that keeps them in the hospital. And this is why I love talking to you, Kay, because it's not just something of the elderly, right? It's not just right. We classically would think of it as oropharyngeal dysphagia, oral frailty, sarcopenic dysphagia in somebody who's frail and elderly. But this issue can span our young, our very, very young, in between, and then our elders more in their senior years. So this is why I want fitness, Kay, to be head to toe fitness. So we
What
keep
do you consider ortomotor for people unfamiliar?
oromotor. So all of these types, and again, this is a very broad spectrum. This encompasses so many wonderful things that I know, the head and neck region. I know. This is why I love this area because it spans so much just from our simple communication here across the screen, right? Our facial expressions, smiling, laughing, we're having a fun time talking about these topics. So speech, the way we communicate, speech, communication, the way we articulate our words, pronunciation, things like this. So all that requires really good oromotor function to do that. And then coming into, again, feeding, chewing, just some of these basics, Kay, that we can take for granted. And all of this is so important across the spectrum of why oromotor function is so important, and yet we can take it for granted. But boy, when it's compromised in some manner, it can be very distressing. So we really want to maintain.
Takes you 1 hour to eat.
It does, yes, yes. So it's a very important process to do. Yes, it takes a long time for you to eat. Exactly.
You describe it as a little TLC for your TLC. How does this idea of tender loving care for the tongue, lips, and cheeks apply here?
Yes. So when I was doing this, and realizing and kind of coming up with some because I wanted to make this fun, okay, right? Because we want to make fitness and exercise a positive experience. We
Mm.
want, and so that way we're more likely to do it. And we can look funny with the way we do it. We stick our tongue out, we're blowing air into our cheeks and we're sucking in our cheeks and we're moving our neck and we're doing all these funny moves. So I wanted to make it something really fun and positive to do. And I wanted family members to do it together. So I wanted moms doing it with children, with their spouses, and incorporate this as part of their everyday habits, to do this every a little bit every day of these types of strengthening uh, movements that they can do with it. So I coined the little phrase, tender love and care for your tongue, lips, and cheeks. And really what that means is, again, tuning in with yourself, with your awareness. How am I taking care of my oral cavity? How are these areas functioning for me? And what are some things that I can do to really work on these functions? How motivated am I? And what tools are out there that can help us? Because, you know, I like the idea of having simple tools, Kay, that can help us perform tasks better, that can get us from point A to point B, where we want to go. And that was another, like I said, one of the, I was doing some exercises, but I wasn't using a tool. I was doing a lot of the speech and language pathology moves and things like this, and some of the face yoga world. And for aesthetics too, a lot of in the face yoga world, they'll do some of these movements for aesthetics because, of course, posture, strength, muscle tone, muscle firmness, all lifting, muscles lift, all
Mm.
have an aesthetic benefit as well to the health. So I just kind of coined that. So we take care of our tongue, we take care of our lips, our cheeks. And so that's why I say a little tender love and care. Same like we do for the body. We do our
Therapy and exercise isn't always fun.
right. Exercise isn't always fun. And we don't, and I didn't want this to be something, I don't want people to dread it. I want it to be a positive, funny experience and laugh about it. And so something that I'm doing with my community as I continue to grow this, we're meeting live like we're doing here on Zoom. And I'll have a lot of people on the screen and we will exercise together so we stay motivated as a community. And I kind of I tease Kay and I say it's like going to the gym with your friends. So, it's like it's going to work out with your pals. I'll drop my daughter off at the gym with her friend, and it's a social time for them, right? It's a fun event. So they'll go in and they encourage each other, and it's a positive thing that they're doing for each other in their youth right now. And they'll go and they'll stay in the gym for an hour. They'll do a little weightlifting, a little treadmill, and a little social interaction too, just like what we're doing here, social interaction. So I love all that concept. And that's what I want to do is build a supportive community. It's a safe space because, like I said, we can look a little funny and people kind of have to get used to the movements. But it's just because the anatomy up here is a little bit different. But the concepts are the same. The concepts are the same as what we do for rehab and therapy below the clavicle. If someone has a
What is
fall,
the oral cavity?
right, the oral cavity, of course, is where the tongue lives, right? Where the teeth are, the boundaries within here are are in here. And we want to have a couple things that I want to make the point about why a closed mouth position is so healthy. And that's what we want. We want that closed mouth position all the time with lips closed. We want lower lip to support upper lip. So we do want the lips to touch. Really important why we want this as well. It encourages nasal breathing, and we'll talk about why nasal breathing is so important and calming. And this is where it can be so wonderful for neurodivergent individuals because breathing through the nose initiates the parasympathetic system. And that's what we want. As I like to go back, it's like equilibrium, right? We always want it. We're working toward a nice, healthy equilibrium in the body. The body, we want to try to keep the body in as much homeostasis as we can. So between the sympathetic and the parasympathetic system, if we're breathing through the mouth all the time, that's going to kick us more into that fight or flight. But if we can breathe through the nose, where we have that wonderful nitric oxide coming out of our nose, that's going to help us relax, calm down, chill. And those are the things that we want. And that brings us back to being able to be focused and present in the moment as well. When we can get rid of those racing thoughts, any of those other types of distractions, to bring us right back. So closed mouth, and the other important things too, Kay, for closed mouth, the oral microbiome. We want a healthy oral microbiome. We want healthy saliva. And so all these things are important. If we have constantly an open mouth, we're going to get dehydrated, the saliva gets sticky, the oral microbiome is not as diverse as we need it to be. And all these things can impact our health with poor gum disease, cavities, all these other health sequelae, which can really worsen. And now you start to see other things happening inside the body. So there's a really important oral systemic disease pathway with keeping the mouth closed that benefits us so much. So I'm a real proponent of sleep with your mouth closed, breathe through your nose, keep the tongue up on the palate, and have really good posture and keep a strong swallow through life. And we can do it. And we can do it through supportive communities and through education like what you're doing, which is incredible to bring.
What type of tactile stimulation does it provide? And why is that so powerful for people with sensory processing differences?
Yes, exactly. So the surface of this, Kay, is very smooth and soothing. So when you have it in the mouth, I can't talk when I have it in the mouth, but when you have it in the mouth and it rubs on the gums, it's like a massage. It's like almost like a vibration. So really, you could consider it in the vibration of the tactile stimuli. It's not a temperature. It's a vibration because it's a massage. So it's very calming, very relaxing, and it's good for the gums. It's good for the gums. It rubs on the gums and helps to stimulate the gums. And so it's very, very comfortable. And it makes sense if you think about it, because this type of material that's so slick and smooth comforts an infant when they use the pacifier for that short period of time. We want infant pacifiers to only be used for a short period of time, but it is very soothing. And so those stress, I find 2K, this is interesting. I'll do a lot of mine in the car when I'm driving, and people laugh but it's okay. And you know what I find? In stressful traffic, I'm much more calmer.
Mm.
So when I'm white knuckle driving, right? I've got 4 lanes of traffic and people are honking and it's crazy out there on the road with road rage. I'm as calm as can be. You know, I've got this and I'm relaxed, and they can honk, honk, honk and do whatever they need to do on the road. But I find it very, very calming. And I love that relaxing mental health component to it as well, for those that might have some higher anxiety issues or in a stressful situation, grief. Some of these things, it can be very soothing, and to use it as a grounding tool as well. And so I think that's a wonderful, wonderful use for these types of tools as well, to do these types of movements.
How might this tool assist those with speech delays, apraxia, or feeding challenges?
Yes. And again, coming back to all of those challenges, right? All of those challenges with motor function, um, trying to do these types of oromotor placement movement exercises. So you put it into place, you strengthen that, try to do some of that repetitive movement, and it will take over time. It just takes, it's not something that can be fixed within a couple of days. Muscle takes a little bit of time to adapt. It does. It takes a little bit of time, and that's okay. This is a marathon. Life is a marathon. It's not a sprint, and I'm in the I'm in the upper years of the marathon. And I want to have for myself, I want to have all of this area strong. I don't want to suffer any of the health sequelae that can come with that open mouth, chronic breathing that can come over 5, 10 years of that. And I'm talking real medical risk factors too, like hypertension, type 2 diabetes, morbid obesity, stroke risk, and of course, obstructive sleep apnea down that pathway. Mhm. And in someone who has the open mouth breathing for over years. Okay, so these are real medical conditions that can happen in this type of, and the reason is because we're in that sympathetic state all night long. We don't have enough REM sleep. It's interruptive to the REM sleep, that really important deep sleep, because we're in that, we're all hyper all night, that jacked up feeling of fight or flight, and we never go into the rest and digest phase if we're struggling to get air. And hence that's why we will mouth breathe. So many great so many benefits, just like the body, so many benefits to keep the body in shape, for fall prevention, all these other issues, why we want to do the body. Same thing up in the head and neck region as well, to keep this area strong, toned, functioning as best as we can. Mhm.
Why is it important to include the face and neck in discussions around strength and physical fitness?
Great question, because with strength and physical fitness, where do we get it? What is the most important nutrient for our body? Oxygen. And where do we get it? Right here and here, which is the secondary orifice, of course. We're obligate nasal breathers, and we want to use our noses, which in our society today, the majority of people have mouth breathing, whether it's partial or full mouth breathing. They may go in and out of mouth breathing, but for so many reasons, allergies, like for me it was allergies, asthma, so many other reasons that people can adapt that habit, and small airways from lack of palatal growth in our youth. But it's just so important, going back, that fitness really needs to be head to toe, because it begins with the airway. And I come back, Kay, to the basics of medicine, right? We call it ABCs, the ABCs of medicine: airway, breathing, circulation. And look what's 1 and 2: airway and breathing, airway and breathing. And that begins up here. So if somebody really wants to be strong and athletic and increase their athletic endurance, the best thing they can do is to train themselves to nasal breathe, is to really, really pay attention to what they're doing, because you're going to aerate the lower parts of the lungs as you breathe through the nose. And then, of course, the nose has that important functions of filtering, humidifying, and warming the air, which is really important to get down in the deep part of the lung and do that really proper gas exchange. So many benefits. And it's not, in my opinion, it's not talked about enough in traditional medicine, Kay, from the background that I come from. That's why I love all the holistic work that I'm seeing out there. I love it. I absolutely love it. Right? I love, you just had Dr. Maria on, talking about the importance of nasal breathing and trying not to, go down the pathway of obstructive sleep apnea. And I'll tell you a story. I'll tell you just today,
How
Kay.
long did it take you to feel better?
It took me, I'd say I probably really started to notice it about 1 to 3 months. And I was training myself to really pay attention, because I was really determined that I'm going to do this. I am determined to not snore. I am determined to sleep fully with my mouth closed. And when I exercise too, I was at the gym earlier, when I walk on the treadmill or when I'm rowing, I breathe through my nose. I breathe in, inhale, exhale through my nose during my workout. I'm stronger. My health, my lab work on my lab work came back in alignment where it needs to be. I haven't had a cholesterol level under 200 in probably a decade. So many wonderful benefits that I personally have had. Same with my husband. He does the exercises. And then same with my son, as we're doing the palatal expansion and we're doing the protraction as well. So we've been able to really make some positive changes there. But now I will tell you, for me though, Kay, I have to work at it. I do my nasal, I clean my nose, right? Morning and night, nasal hygiene. So I do my nasal hygiene, and I always have my box of tissues near me. So I always have my tissues and my nasal saline flush, but that's me because I am a lifelong allergy sufferer, and that's what I do to help manage my condition. We all carry a cross. I say everybody carries some type of cross, and it's just what our day-to-day things that we can do to manage these things. But having community, having support, having the right tools in place makes such a difference, can make such a difference. And now this is where life gets good. This is where life gets good. Forming
Does it help
friendships.
prevent colds?
Yes, very good. Yes, absolutely. Very good. It absolutely does, because when you nasal breathe, one of the other wonderful benefits of nitric oxide, we love nitric oxide coming out of the nose. Okay. Just we want to say that it has antimicrobial properties. So it can help fight viral infections, help fight bacterial infections. Wonderful function of the nose, something the mouth does not provide. The mouth does not warm air. The mouth does not produce nitric oxide. The mouth does not filter air. There's no cilia on the cells that line the air. There's no nasal hairs in the mouth, right? To catch the dust particles and things like this that we want to filter out, the bad guys. There's no humidifying benefits of the mouth. They don't have turbinates. Turbinates are in the nose that help us uh, do these properties of the nose. So the mouth provides no other benefits than a secondary backup airway. And that's really, really important for people to really, really think about. And it's really important to really, and the nose has such a prominent position right here up on our faces. It has a critical function for us. And boy, it's just amazing that here I am at this phase of my life that I'm really tuning into this, having been an allergy sufferer, but it's not emphasized. Like I said, it's not really emphasized in the traditional medical background that I'm coming from. It really took looking out and working with like I said, my family, with working through the cleft lip, the cleft palate challenges, and the health sequelae that come with that as well, which are all related so much to breathing. But you can't talk about breathing without talking about dysphagia too, because if you're not breathing right in that low tongue position, you're going to have dysphagia. It's possible not to have that at some point. So we really want to work on that. So we'll do some exercises later when we off screen or with your folks when I send you the products. So, but we want to really work on that and develop those really good oral habits, oral posture, which
How
is
does incorporating facial fitness boost body confidence and a sense of control, especially for neurodivergent individuals?
yes, exactly. If you're able to reflect with the expressions and everything out here, and you're able to socialize, and you're able to have a meal and socialize. Mealtime is so important, right? Mealtime is a time for socialization. We don't want folks to retreat. We don't want anybody to go into any type of social isolation. So we want that confidence. We want someone to feel really confident, Kay. We want them to feel good. We want them to be able to reflect here what they're feeling on the inside. And that is something that's so important to me. And that's why I talk about the aesthetic component, right? The beauty component. When everything is kind of functioning really well up here, you're able to really have that social confidence, have that ability to really engage with others in the manner that you desire. And that's a great thing to be able to do. So that's an absolute very, uh very important process. The
What
social,
makes
it's like
this tool accessible and adaptable across different support needs and ability levels?
yeah, so this is what I really wanted to do. I didn't want to have something that required batteries or required Wi-Fi, or red light there, another gadget where you have to turn the button on and off, right? I wanted something, Kay, that with anybody with intellectual challenges, young or old, anybody with dementia, anybody with dementia, or sundowning or or on medications where you could have these types of mental status changes, that this is safe, that this can be used. You can roll over this, you can poke your eye. You're not going to choke. So this was really important to me. So this can be used in the hospital setting. I would love to see this on our rehab floors for conditions like stroke rehab, things like this. And then
Yeah.
the family members, right? The family members can use this with their loved one to engage the tongue, strengthen that tongue, so we can bring back the speech and not have the drooling, and we can prevent the spillage around the lips and strengthen that lip seal. So all this. So this was really important to me. Like I said, you can fall on this, you can roll over in bed.
Mhm.
And it's right, it's safe. You're not gonna like a lot. Some of these things have, a handle and you could poke, or choke. And so that was really important to me too, to make sure that any of those types of conditions are super safe. We're always safe. I'm always thinking safety.
Yeah.
Thank you, Dr. Kennedy, for doing this with me. It was great to have you on. Please share this talk show with your family, friends, clients, and colleagues. Everyone watching, don't forget to like, follow, subscribe, and share on Facebook, Instagram, and YouTube.